it affirms that every woman have the rights of the prevention. The government must know that it's the right for the woman to be prevented, to be early diagnosed, and to have a quality care also, because no matter where this woman lives and how much money she need to have this. She have these rights: the right to survive, the right to not have this cancer, so this disease that is avoidable. So just to say that yes, elimination. That we are talking about elimination of cervical cancer is not only a public health, it's a human rights and gender equity agenda for Africa, and it must be like this.
Hello and welcome to another episode of the Africa Routine Podcast. I am Nontobeko Mlambo. So January is Cervical Cancer Awareness Month, a time to spotlight one of the most preventable yet deadliest cancers affecting women across Africa. In this episode, we turn our focus to the urgent and collective effort to eliminate cervical cancer on the African continent. I am joined by Dr. Dille Issimouha. She's a technical officer for cancer control at the World Health Organization's Africa region. In our conversation, we explore how cervical cancer continues to impact millions of women and girls, why Africa bears a disproportionate burden of the disease, and what is being done to change this reality. From HPV vaccination and screening to treatment access and health system strengthening, Dr. Issimouha shares insights into WHO's work to support African countries in achieving the global goal of eliminating cervical cancer as a public health problem. This is a conversation about health, equity, dignity, and the power of prevention. But before we get into the conversation with Dr. Issimouha, here are some key facts about cervical cancer. Cervical cancer or cervical cancer, depending on whichever way you decide to pronounce it, it is one of the leading causes of cancer-related deaths among women in Africa, despite being largely preventable through vaccination, screening, and early treatment. The World Health Organization has launched a global strategy to eliminate cervical cancer. So to eliminate cervical cancer, countries need to reduce new cases to fewer than 4 out of every 100,000 women. This can be achieved by focusing on 3 main actions. The first one being vaccination. 90% of girls should receive the HPV vaccine by the age of 15. The second one is screening. 70% of women should be screened with a reliable test by the age of 35 and again at the age of 45. The third and last one is treatment. 90% of women with pre-cancer should receive treatment, and 90% of women with cervical cancer should be properly treated. If countries reach these 90, 70, 90 targets by 2030, they will be on track to eliminate cervical cancer as a public health problem within the next century. Thank you so much, Dr. Dille, for joining me today on such an important topic, especially since it is Cervical Cancer Awareness Month. Could you please just start by telling us who you are and your role at WHO?
Thank you. I am Dille Issimouha, so I am the regional advisor for cancer at WHO Regional Office for Africa. I'm a surgical oncologist by background and public health, and yes, I'm happy to be here.
Thank you so much for taking your time to do this with us. Just to set the scene for our listeners, could you start by maybe explaining the World Health Organization's global strategy to eliminate cervical cancer and why Africa is such a central focus of this initiative?
So the Cervical Cancer Elimination Initiative is actually very simple and powerful. So it's built around the 1970-19 targets by 2030. Is about vaccinated 90% of the girls against HPV and screen 70 of the women with a high performance test at least twice in their life, and making sure that 90 of the women screened receive the adequate treatments. So, and for Africa, really, it's an urgency because 18 of the top 20 countries with the highest burden of cervical cancer are in our region. In 2022 alone, Africa was account for 23% of the global death for cervical cancer. So you see that really, if we didn't accelerate this, our action, those numbers will never fail, and they will rise. They will rise. So this strategy for our region in Africa is not only a strategy. Let me tell you that we are at the heart of this of this problem. So really, it's something that matter a lot in our program.
You just mentioned how Africa is at the heart of this problem and how 18 out of the 20 countries with the highest burden are in Africa, and that it still kills millions of people despite it being largely preventable. What factors continue to drive this burden across the continent?
The factor that I can say that really is leading this is the health system capacity and equity. First, many countries still have a very low coverage in HPV vaccine and screening because, as I told you, we have the 1917-19. This strategy, the success of this strategy based on screening and treatment and also vaccination. So if you remain the coverage remain low, you can understand that really the objective is not reached. We have many deaths on in our region. So most of the women also are diagnosed very late because lack of screening, very late, and with advanced stage. But also, when they are diagnosed advanced stage, they don't have access to treatment. So we have a regional assessment that we have done last year and we released. In this assessment, we saw that we have a major gap in terms of diagnosis readiness. Some of the country don't have even one pathology lab. And you can say, how can you diagnose a cancer if you don't have even a pathology lab? Can you imagine? The shortage of human resources also for diagnosis, pathologists, radiologists, all this. The tools, the equipment for you see, for the diagnosis, all this. And mostly the radiotherapy. You know, radiotherapy is essential for cervical cancer treatment. And we still have around 20 countries over the 47 that don't even have one machine for the treatment. So you can imagine really that we have some highest burden country that have cervical cancer, and they don't have even the capacity to diagnose and the capacity to treat. So really, it's why cervical cancer remain a leader killer, not only because of we lack tools. We have tools, but too many women don't have access to this treatment and to this diagnosis at the right time.
So, talking of access, and then you speak also of the importance of vaccination and how it's a key pillar of prevention. It would be great maybe to talk about progress so far, what advances have been made in rolling out HPV vaccines across the continent, and maybe where some of the significant gaps that may still remain.
Yes, thank you. The good news is that, now the policy environment for vaccine is good because WHO recommend 2022 one dose. So this one dose. So one dose is okay. It can be really it's cover the prevention for the girl or the woman, and we make the progress in our region because now we have 35 over the 47 countries that introduce the vaccine in the immunization schedule. So we have the countries now that more countries that now introduce the vaccine, and this vaccine is free for girls. And also, but the coverage is still low because we have 47%. We want to reach 90% by 2030, but now we are at 47% of girl. This is the number of 2040 because we have the data. 2040 we didn't have reached 2025. No, we have 2024. So and we have just 4 countries that reach the target. We have Burkina Faso, Uganda, Tanzania, and Botswana that reach the target. Even more, we have Burkina Faso that have 99% of girls vaccinated. You see that really some countries are really making a lot of efforts. But the problem also is the sustainability of this coverage. We have some countries that have, for example, Seychelles, that have 91 in 2022, but now they decline in 79. So you see that really even the sustainability of this coverage, not only reach the coverage, but maintain it to make the coverage of the vaccine, to make the elimination possible. So it's just what I can say about vaccine.
Okay. You said we are still on 47%. And we want to get to 90% by 2030, or just everyone vaccinated by then. How is the World Health Organization supporting governments to expand these HPV vaccination coverages? Those countries that are remaining behind, or the hard to reach areas or marginalized settings?
We are working hard to make the vaccine available and affordable for the populations. And that should support our population also in terms of policy guidance, in terms of national strategy development, because everything starts by planification. We support them to include this, to make prioritize the vaccine and the screening and the prevention in their national strategy. So it's something very practical that need to be done before even introducing the vaccine in the country. So it's why we have this 35 countries, and we have more also now in this 2026 now that will include. So part of what WHO is supporting also is not only integrated HPV vaccination in the routine immunization system, but also strengthening school-based delivery, because it's one key of the success that we have. School-based vaccination make the vaccine available. So at the age that is needed, because we wanted the girl to be vaccinated before 15 years old. So you see that these girls at school is very important. And also expanding outreach for the girls who are not in school, and working with community, because we still have misinformation and fear for this vaccine. And it's important that, so WHO is also supporting a lot with civil society organization, engagement, communication, awareness, all this, to overcome just this misinformation about vaccine. But I think that the goal is really to not let any girl behind, because what is important is not vaccination. All the vaccination before people have misinformation about many vaccination. But what people need to keep in mind, and what we are really insisting on in WHO, is that this disease, cervical cancer, is avoidable. Is one of the cancer who is really avoidable. We don't have a lot. And if you have just one tool, very powerful, that give that that show results, please, we wanted people to give their girls, their children, have the chance to have this the opportunity to avoid this cancer, because it's really, really, very difficult, cervical cancer.
So beyond medical aspects, cervical cancer is also deeply connected to issues of gender equity and human rights. How does eliminating cervical cancer contribute to improving women's health, dignity, and rights across the continent?
Yes, this is a good point. Yeah, it's really, because is really the strongest aspect of gender justice that we can make in public health. This disease kills women in the prime of their lives, when they are raising families, they are working, they are contributing to the community. All the country want to be developed, and cervical cancer came at the women at very early age in our continent, our region, when these women have all the hope, is the hope of her community. So preventing this cervical cancer for women is really protecting women's health, their dignity, and really also their future for the woman, for the girl. And also it prevents family to really they prevent them really to push them into poverty by catastrophic health costs, because you know that if we say that, for example, screening cervical cancer is just $1 or $2, so treatment can be $2,000, $3,000. So we see that how many families in our region have this amount to use for health. So you see that really is something that's, and beyond that also, it's help. It affirms that every woman have the rights of the prevention. The government must know that it's the right for the woman to be to be early diagnosed, and to have a quality care also, because no matter where this woman lives and how much money she have, she need to have this. She have had these rights, the right to survive, the right to not have this cancer. So this disease that is avoidable. So just to say that, yes, elimination, that we are talking about elimination of cervical cancer is not only a public goal health, it's a human rights and gender equity agenda for Africa. And it must be like this.
Yeah. We're talking about screening just now and how effective it is only if it leads to treatment. And, you were saying that access remains a major challenge in many of these settings. What steps are you taking to ensure that there is timely, affordable, and quality treatment for precancerous lesions and invasive cervical cancer?
So we're supporting countries. We have an initiative now. It's Women Integrity Services, for example, that we are they are implementing in 3 countries in Africa that make cervical cancer an entry point in primary health care screening, an entry point. So, for example, we are supporting these countries to have the women at primary health care to have access to cervical cancer screening and treatment, because it's not only about be screened. You say that, okay, I have a pre-cancer. What after this? You need to treat immediately at primary health care level. So we have some powerful tool like thermal ablation device that are really something that can be used in any kind of setting, because they have battery. All this is for the treatment for pre-cancer. So WHO is supporting, together with the organization that like UNICEF and the other discipline, we are supporting the country to have this device because it's low cost and it's used for the treatment. So we have this in these 3. We are supporting these 3 countries, but we are also supporting also many other countries. Like, for example, last year in Madagascar. Madagascar is one of the countries with a high burden. WHO support to make available this treatment in more than 20 primary healthcare setting, and in other countries, in Namibia also. You see, we have many countries like this. And yes, and what I can say, last time also in Eswatini, I was there. It was very good. Eswatini is one of the countries also with high burden. We were there and we trained people. We train healthcare workers to deliver a kind of treatment. It's a small surgical treatment, but it's a surgical treatment that can be done only in some setting. So they have a problem in terms of a lack of human resources trained, and WHO went in the ground, we went in the ground to train them. So now they have more capacity to treat the people with pre-cancer. So this is for pre-cancer. And for cancer, let's say that we are supporting together with other organizations like IAA, who is supporting the radiotherapy center. We are supporting in terms of assessments of the health system, because we need to know what is a need, what are the status of the cancer control in the country before acting. So it's what we are doing. It's them impact review. So we are doing it together with the National Cancer Control Plan, developing with the countries. Every year we have many countries that are requesting this support. And we are supporting in this type of policy, and to make them, and after this, we have strong recommendation to make them understand that really this is what we find, which is the gap, and how to overcome all these gaps. So is like some this kind of support that really we are supporting. But what is really important that WHO is focusing on for policy maker also really is to understand that cervical cancer is really the most cost-effective way, and the most cost-effective way to uh, to reach the objective of the elimination is to integrate it. This screening at primary healthcare level is really the message that we are trying to give. And this year is the big message that we are trying also to give to the countries.
You've mentioned how other African countries are on track to eliminate cervical cancer by 2030, like the Seychelles, but we also spoke about how many other African countries still face complex health system challenges. It could be conflict, it could be lack of resources, like in countries like Eswatini, like you just mentioned. But in all of this, you speak about the main focus of the WHO being to integrate screening at primary healthcare level. What are some of the barriers to cervical cancer prevention and care in this context, and how can they be addressed?
Yes, yes, we have a lot of, as we said, in this region, we have a lot of of challenges in it. But what I can say, the biggest barrier I can say is really is social and is systemic. It's not only medical, because we have now many very what can I say, we have many medical people that really are giving their time, their life for it. But the system is a problem, is very problematic. Because you see, for example, in many rural facilities setting, the health facility don't have the basic. They don't have the basic. The staff are not trained. Even they are here, they are not trained always in terms of screening, in terms of treatment of pre-cancer. They don't have also, even if they are trained, they don't have really the supplies, the diagnostic tool, the referral pathway, transport, all this for the women. So women, sometimes they need to do hundreds kilometers to just to do the screening or the treatment. So really, it's something that is I can say is one of the biggest challenge. And in the conflict area also, we have many now in our region in this time, unfortunately. And we have the insecurity who also disrupt the services. The health workers leave. We can see in some of the countries they leave the I think most, perhaps half of the country, we don't have any healthcare workers, and the supply chain also break down, and this is even is difficult. The other things is financial and social barrier. Many of the women cannot afford the transport fees just to go to do the screening, because it's not close to the facility. It's why I told you that really we are now working on supporting countries on making them understand that they need to strengthen the primary health care, because it's the place who is close to the women. And also we have the stigma and the fear, because women, they think that, okay, let me, if I went to the screening, they will tell me I have a disease, but we cannot tell you what you don't have, my dear. So is this fear, this stigma also, we need to work on it, and we are trying to work on it, and to also educate healthcare workers really, to make them understand that no, a disease cannot appear just because you go. But if you stay at home, nobody will not know, and will have this cancer develop, and avoidable cancer. So you see, the stigma and the fear is something that really also. But what WHO is promoting also for this, the health HPV self sampling, you see, is something very important, because the women, they don't just want to go to the facility because they don't want to be touched by healthcare workers. Sometimes they are men, sometimes even women. They don't have even, they don't want to go for this. But when they have the self sampling, they can do the test for their own. They explain to them. So the HPV testing can be done like this. So I think that these things can be also, and they can be done at primary health care also, and they can be done at the maternity service. the place where the women are going. So I think that is also something like this that we are promoting to make the women very comfortable for the screening and other things.
Okay. So as we look forward, what messages would you like to share with African women, girls, policymakers, and health leaders about the future of cervical cancer elimination in the continent?
I have many messages.
You can say all of them.
Yes, because what I can say that really is urgent, is an urgency, but it also hope. Because cervical cancer is one of the few cancer that can be eliminated in our lifetime. People need to understand that we have hundreds kind of cancer. We have cancer for skin. We have cancer for I can say for bones. For many, all of the organs can have many kind of cancer. But cervical cancer is only one that can be eliminated as public health. So people need to understand this, that we have the tools, we have the vaccine that works. We have the high performance screening tests. We have effective treatment for pre-cancer and for cancer. So I want to tell the woman and the girl, please get vaccinated and go to vaccine your children. Get screened and seek care early when you find something is not normal. So it's not normal, please go and seek care. These services can save your life. To policymakers, I want to say that cervical cancer elimination is one of the smartest investments you can make in women's health and national development. It saves lives. It reduces the poverty and strengthening the health system, because making in place everything for the screening is strengthening the health system itself, not only for cervical cancer, but for the other cancer, for the other chronic disease. The science is there. The strategy is there. What we need is political will, is to sustain the financing, not only waiting the donors, no, the domestic financing, because it's our population, it's our health. And we need to scale up and speed this elimination. Because if you act decisively, Africa can lead the world, the entire world to eliminate cervical cancer, because they are the one who have the high burden. If it didn't start in Africa, the world will never eliminate cervical cancer. So it's just what I wanted to say to everyone.
Thank you so much, Dr. Dille. Thank you so much for taking your time and talking to us and all your insights. And thank you for all that you do for the continent. Thank you.
Thank you so much for all you are doing also. Thank you.
Thank you.
As our conversation with Dr. Dille makes clear, eliminating cervical cancer in Africa is both possible and within reach, but only if prevention, early detection, and treatment are made accessible to every woman and girl, regardless of where she lives. As we mark Cervical Cancer Awareness Month, the message is clear: no woman should die from a preventable disease. With the right tools, partnerships, and leadership, Africa can lead the way towards a future free from cervical cancer. You have been listening to the Africa Within podcast. We say thank you to Dr. Dille for an amazing work that she does with her team, and to everyone that is doing their part. If you found this episode informative, please share it with a friend, like and subscribe for more health-related content. Thank you so much for listening. See you next time.